Hey there, it's Dr. Jenny Tufenkian here with a Reminder to Love platform for education and inspiration. So it has been just an incredibly difficult year this year for sinus infections. I know a lot of you there are listening right now because you have some symptoms of sinusitis, either chronic or acute, or you're living with somebody that does, or you're trying to help out somebody in your family. So I totally get it. I'm actually dealing with a little thing myself right now. So I want to hopefully shed some light on these little cozy little dark caves that we have in our brain, in our head, and help you begin to understand how they work and what we can do to support them so that you can get symptom-free. So we have 4 pairs of sinuses in our head. We have the frontal up here. We have maxillary right here. We have something called sphenoid right here, and then behind that are we have erythmoid, and then sphenoid behind that, and they're pairs. So they're just these dark little holes, and what do? They do lots of different things. So one is they keep your head lighter. Can you imagine if they were filled up? Your head would just be that many pounds heavier. I tried to Google how many pounds that would be, but I couldn't figure out how many pounds it would be if they were filled up. But if you have like really bad sinusitis right now, you kind of get the idea because it probably feels like you have cement in there. They also, one of their main jobs, though, is to actually purify the air for us. So as we breathe in, we take air in, it goes in through our nose, it goes into our sinus, and our sinuses are lined with these really cool cells. They secrete mucus, a whole liter a day. Isn't that so tasty? And they also have these little ciliary bodies on them that just kind of move. They're supposed to beat like 16 times a second. And just, I always imagine them being like little seaweeds, like in the ocean, or like wheat fields in the wind. And you just end up having this movement all the time that is moving debris and viruses and all that through the mucus and helping, hey Liz, helping clear out all the mucus. They also have, you have macrophages and other cells that are immune functioning cells in your sinus. So as the air introduces pathogens in, it alerts the immune system. And if necessary, it'll create more mucus to move that out of your body, have it drain down your throat and go into your gut so that you can get rid of them. So it's really a very, very important function. It also protects our head if we fall. It offers some cushioning so it doesn't go straight to the brain, and it protects the nerves in your head, and also creates changes our voice. It helps influence the resonance when we're speaking. So really important little things that we probably don't think about that much until they hurt, right? Like now. So sinusitis really just means itis means inflammation of anything. So sinusitis means inflammation of the sinuses. And that can happen in an acute or chronic situation. Inflammation can happen from a variety of things. It can happen from a toxic exposure. You can walk into a room full of chemicals and it can really inflame your sinuses. Smoke is just a classic one. A lot of people get sinusitis from smoke inhalation. Having be infected by a virus, bacteria, fungus, mycotoxins, mold, all those things can really trigger something in your sinuses, as can foods. So really common symptom of a food allergy is to have chronic or acute sinusitis come up. I'll be talking more about that in a minute. So, and it's really easy to get the symptoms of sinusitis, which is that it's that headache. You can get the pain where any of the sinuses are. It can be referred to the ears or to the teeth. Sometimes you think there's something wrong with your tooth, and it's actually a sinus infection. That's very common. You can get sort of this congested feeling down your neck. Fatigue is very common. It's a lot of work for your body to be dealing with this level of inflammation in your head. And if you've been mouth breathing, you get a lot less oxygen into your brain. So you can kind of have that brain fog, maybe due to low oxygen as well. You may have a ton of discharge or none at all. So if the sinuses are really blocked up or maybe dry, then you may not be getting that discharge. But frequently you're getting discharge, and it might be clear. That's usually more due to an allergy, or yellow, and green is more due to an infectious type of process. So those are some of the symptoms, as you know, many of you are familiar with them. You may also have a fever, and I will note that if you have a fever of above 102 and it came on suddenly or it's getting worse, that may be a sign of a serious bacterial infection and is likely a time that you might want to consult your physician. And just to note while I'm saying the word physician, reminding me to say that I am a physician, but I can't be your doctor, so this is just advice, or it's just information, not advice, medical advice for you. If you have an acute sinusitis, it's your body doing its job, right? You've had a virus or a toxic exposure and your sinuses are flaring up. They're secreting more mucus, they're getting clogged up, and it feels clogged because there's very thin passageways, just millimeters of passageways in the sinuses, and so it's really easy to get clogged up quickly. And a lot of the therapies I'm going to be mentioning in a few minutes will really help an acute infection move faster, and will also help your body begin to actually heal and support your body. Conversely to the decongestants you can buy over the counter, those do take care of the symptoms, but they're not really helping any of the underlying problems. And sometimes there's this thing where you can get this rebound problem where you get all cleared up and then you go off of it for a few hours or a day or two and it gets way worse and it's a rebound problem. We don't find that when we use natural remedies to treat sinus infections, whether they're acute or chronic. We find that you get more sustained benefit when you use natural remedies, such as the essential oils, such as all the things I'll be talking about in a second. When we talk about chronic sinusitis, that's having the symptoms for 1 or 2 months or more. And it's really, a lot of people have it. 1 in 7 Americans have chronic sinusitis. I have no idea what the world numbers are on that. It'd be sort of interesting to look and see what they are. So it's very, very common. And conventional treatment for chronic sinusitis and acute for acute it's decongestions and taking antibiotics. For chronic, it's antibiotics, antifungals, doing what we call the Roto-Rooter, which is where they go in and they clear out all the debris in the sinuses. Really intensive procedure. It does often give people relief, but we frequently see people getting the symptoms back again. And that makes sense to us who practice naturopathic and functional medicine because you're not treating the underlying disease. I really think conventional medicine is missing the boat here because what they are going after is one pathogen that might be causing the problem, saying, oh, it's a fungal or oh, it's bacterial, we need to get rid of it. And really what sinusitis is in the chronic sinusitis is it's an imbalance, and it's an imbalance in the actual sinuses themselves and with the rest of the body, especially the gut, the lungs, the lymphatic system, and your emotions. So all of those work together to support the sinuses, and the sinuses are part of a system. And it really helps to look at it much more holistically in this way to get lasting results and to really get your health back. So you need to support the nasal microbiome. And yes, I just said that. The nasal is this like warm little, luscious little cave, and it has its own microbiome. They call it the mucosal blanket. Isn't that cozy? I love that. Mucosal blanket. It makes me think of the blanket I had when I was like 6 years old and I would take to my grandma's when my parents left me. So it's just super cozy. So you want to take care of that mucosal blanket, and that mucosal blanket has fungus in it. It has bacteria, it has your mucus preceding cells, and it has biofilm. And what they have found that even in healthy bodies, there's bacteria, fungus, and all of that. We need that balance. There's one researcher that found that actually people with chronic sinusitis or people who get a lot more acute sinusitis, they don't have enough variety of different kinds of bacteria and fungus in their sinuses. And they're actually doing a research study looking at Lactobacillus sakei, S-A-K-E-I, and it is a lactobacillus species that we find in fermented food. So they're suggesting you snort fermented food juice. I'm not quite there yet, but I think it's pretty interesting information to have. And I wanted to mention the biofilm because in the past I've really thought about biofilm as being this bad tenement housing. You got to get rid of it. It houses all these bad things. And I've really come to realize that biofilm is just a community. It is a structure that bacteria, fungus, mycotoxins, all these things live and grow in. It creates a structure where it's easier for them to live. It's a supportive community. And it's like any other neighborhood. If it's got good folks in it, it's great, and it's a really good system. If it's filled with bad stuff, then it's not great and you want to get rid of it. So it's really just a question of what is in your biofilm. Myself, I'm dealing with mycotoxins in my biofilm from a black mold situation I had in my house. So my biofilm needs clearing out, and I've been working with that for a little while, working on clearing that out. If you have a nice biofilm, it's like the nice shiny layer, and it's just part of that lovely mucus blanket. One of the ways that you can keep your mucosa healthy is to drink a lot of water. Water is the best mucolytic out there. It's really fantastic, and you want to drink a lot of it to keep your sinus cavity healthy. Also, you want to support that cilia. Keep them moving, keep them waving and moving. I read about a way to test it, which is to inhale a little bit, just one little granule of saccharin, and see if you get the sweet taste. It should take about 30 minutes, and then your cilia is functioning normally. I really wanted to try it with stevia. I don't want saccharin in my body. I wanted to try it with stevia, and I couldn't find our stevia. But I will try it, and I'll Facebook you guys when I do it, or if you guys want to try it, let me know what you find out. I'm really curious to see what my cilia timing is, and I thought that was kind of a cool little test. Using the oils that I'm going to suggest in a minute will also really help that cilia and just health of that whole sinus microbiome. You really want to keep your gut healthy. Oh, the other thing I would say about the cilia is lymphatic support. So we've talked about lymph before, and lymphatic support is really important for every system in the body. But since that cilia is part of that mucus moving toxin type system, really just doing any kind of body movement will really support it. So just moving, doing a little bit of Tai Chi, Qigong, whatever you can do in the state that you're in with the health that you have. So your gut. So your gut and your sinuses are intimately connected, and you want to keep your gut microbiome super healthy. So that's eating a great diet, making sure you are taking probiotics like PB Assist and your prebiotics, which are also in PB Assist, and also taking digestive enzymes can be really helpful, especially if you've got a lot of mucus going down your postnasal, you have a lot of postnasal drip and mucus, and you get kind of that gross stomach. Digestive enzymes can help break up that yuckiness. The digestive enzymes in Terrazyme will also help break up the bad biofilm, so they're beneficial in that way on an empty stomach. Take them with when you're eating to help break down foods that you might be eating that you might be sensitive to. Food sensitivities frequently show up in the sinuses, which I'm going to talk about the foods not to eat, and they would be things like sugar, because that decreases your immune system for hours after you eat it. Caffeine can give you some relief from sinusitis, but it is short-lived and it's actually draining your adrenals, so not ultimately in your best interest to do caffeine. Fried foods are really they're too sticky and hot and not great for the sinuses when you're going on. And then there's dairy and dairy and dairy and dairy. And did I mention dairy? I'm sorry. I know there's nothing like melted cheese. There's nothing like yogurt. I get it. But dairy is terrible for the sinuses if they're flared up, and particularly if you have a sensitivity to dairy. And that comes from both a naturopathic and a Chinese medicine perspective. So naturopathic perspective, we think about the gut as the microbiome. You really want to have that set. 80% of your immune system is in your gut. So you really want to support your gut. And basically your brain is your gut. So you really want to support your gut. From a Chinese medicine perspective, I was talking to my friend and colleague, Dr. Mika Karu, the other day about this, and she was talking about how these intimate little channels between the sinuses and the lungs and the digestive system. So you have this large intestine sinus relationship going on. There are actual energetic channels between them. So supporting one, you support the other, which makes sense when we start talking about some of the remedies that we go, oh, those are good for the gut and they're also good for the sinus. We'll get there in just a second, so hold on. And so you really want to support your gut to support your sinuses. Check for food sensitivities. If you think you have them, come see a naturopath or a functional medicine doctor to get them checked out. And what you want to eat are warming foods. You want things that increase that digestive fire. And some of the great things to eat are the alliums. So garlic, leeks, onions, all those are very, very warming. They're anti-infective themselves. So they will really help heal from chronic and acute sinus infections. Also, some of the peppers, or some spicy peppers can be great, and ginger is wonderful, very warming, helps move things. So those are really great things to eat. So one of the things that I love to do for sinuses, and we've been talking about for years in naturopathic medicine, is to do nasal lavage. And a lot of you, I know about using a neti pot. I just want to add a few little things to that might boost your effectiveness for using it. So one is that if you do alternating hot and cold to your sinuses before you do the neti pot, you really increase the blood circulation to the sinuses. So I have been known to travel when I'm dealing with stuff with my little Ziploc bag with a washcloth in it, and I will stand in the bathroom in an airport and run hot water on the washcloth. It was easier before they had those little instant things, but I still do it. And run it under there and wring it out, and you just hold it on your face for just 30 seconds, minute, whatever feels good, and then you run it under cold, wring it out, put that on, and you repeat that 3 times, and then you lavage. Makes a huge difference in terms of the effectiveness of getting stuff out and really getting that relief from that nasty congestion feeling that you have. The other thing that I've started using, and sorry I dropped it, so excuse me while I bend down, but I have started using, because I'm dealing with this chronic condition, I've started using this Sinugator thing here. What I like about it is that when you press the button, whoop, it has water in it, but it vibrates, and that actually, it's like a massage for the cilia, and it really wakes the cilia up and gets them moving again, which again is just the foundation for sinus health. So I really like using this. The only thing I don't like about it is it's plastic, so I don't like putting really hot water here in the plastic because I'm afraid I'm putting plastic in my sinuses. So that's the only thing I don't like. I will be really stoked if somebody develops a glass one. Don't know how that would work, but I think it'd be cool. You can put things in your neti pot. You definitely want to put some salts, maybe a little baking soda as a buffer, or you can get little packets for those. I have also put allicin, which is a form of garlic, in. Colloidal silver is great to go in there. And I know there's been a lot of discussion about should you put essential oils in your neti pot and in your Sinugator or not. And here's the thing. You definitely need to be careful. And I always say first do no harm. So I would never do it with a child. I would never do it with somebody who's really sensitive. And I would be really cautious in everybody else. And I would be cautious with the oils I use and how much I use. So I have done it on myself, and I've used frankincense, I've used melaleuca, I've used up to a drop, but usually the best way to do it is to just, when you're cooking with it, you just want a little bit, just drop a little toothpick into the bottle, get a little bit on the toothpick, stir it into your neti pot solution, and then use it that way. Just use a microdose. You'd be surprised at how little you need to get an effect when you're in there. The concern is that you can damage the mucosa layer. It's a very sensitive skin. It's like mucosa anywhere. You think about your eyes and other places you have exposed mucosa, you really don't want to put anything in there. So don't use something like On Guard or oregano in there. You will cause damage to your body. And instead of being beneficial, you'll have one of those toxic experiences with the oils. That said, there are some great ways to use the oils I'll be talking about in just a second. The other thing that is great to do are warming socks for any kind of sinus issue, and that is where you take a pair of cotton socks, a pair of wool socks, get your feet really hot, wring them out with, get your cold wet cotton socks on your hot feet and put dry wool socks on top. That will really help your sinus clearing while you're sleeping at night and increases your white blood cell production. There are a lot of different oils that you can use to help clear up your sinuses. And it depends on what you're going for. So if you know it's a virus, or if you know it's a bacteria, or you know it's a fungus, you can kind of tip your oils depending on where you want to go. But I will say, and I've said this before, and I'll say it again, and I'll say it again, the real amazing thing about using the oils is that they're so broad spectrum. They treat so many different things, and they treat on the physical level where we have them actually going after the viruses, after the bacteria, after the fungus, and they can open things up and all of that. But there's also the energetic and emotional parts too. There's another, I'll talk about the oils in just one second, because I want to introduce another concept to you, which is that your sinuses are also your emunctories. And we have talked about emunctories, which are the organs for elimination. It's how the body gets rid of toxicity in the body. So like your lungs, your liver, your gut, your skin, all those are emunctories. And those are the primary emunctories. Kidneys are included there too. But the secondary emunctories are all of your mucous membranes. So yes, your vagina, your sinuses, all your mucous membranes are secondary emunctories. If the primary emunctories are backed up, the secondary emunctories come into play. So if you have chronic sinusitis, it may be because your other emunctories are not open enough and not functioning. So you want to make sure that those are working. You can go back and look at other Facebook Lives I've done, and Dr. Louise Rose has done some, and look at those and begin to understand, or Facebook, or question me, ask me. I'd be happy to answer again how to get your emunctories working, because they're really important. The other thing that the emunctories can do is they can hold and release emotional experiences. So sometimes sinusitis is actually a blocked emotional experience. It could be grief, it could be anger, it could be all kinds of things. There's this layering that happens between things and emotions. So whether it's a heavy metal, whether it's a bacteria, a pathogen, anything, it layers in with emotionals, and they get stuck in different parts in our body. And those little cozy sinus cavities are one of the places they love to get stuck. So that may be something where you can work on, and when you're choosing your oils, choose some emotional oils to help process the grief. Like maybe you need to use Forgive to help release some anger and to open up to another level of grieving. If you're really grieving deeply, maybe it's Console that you need to help alleviate some of that pain you're experiencing from loss of, relationship, time, whatever it is that you're grieving. You might need to use Balance if you feel like your life is just insane right now, like it is for many of us, and you need to calm things down. Or maybe it's Serenity. So just keep that in mind. The other oils that are great, I love Thyme. It's a total great antiviral, and it really opens things up. So sometimes with my thing, I get this real congested feeling all the way down one side of my head and one side of my neck, and I just love using, I'll use castor oil and thyme oil together and just massage all the way in here and massage onto my sinuses, and it feels great. Peppermint is really fantastic. It really breaks things open. It's very energizing and breaks through that energetically and physically, breaks through things. In Chinese medicine, it's considered to break the phlegm and open up the channels. And when I was talking to Dr. Karush, we were talking about Digesen, and I found it so interesting that a digestive blend is so great for the sinuses. And this is where I'm talking about that connection between the gut and the sinuses. Digesen has peppermint in it, so it's opening, right? And then it has ginger in there, which is, once things are open, the ginger can go in and warm up the spleen and warm up the gut and warm things up so that more can be released and healed. It has very soothing and cooling herbs in there, the anise and the fennel, and those can be very soothing. And fennel is amazing for anything that has to do with, like, if you're trying to get rid of molds and funguses, especially if they're affecting the lungs and the sinuses, fennel's great to diffuse to help with that. The other oils that are great, rosemary is really great antiviral. And again, if you think you're dealing with a fungal mold mycotoxin issue, diffuse rosemary. And pine is great as an antiviral and antifungal, as is eucalyptus is fantastic as another one of those openings, kind of like peppermint. It really opens and shifts things energetically. Of course, Breathe, your respiratory blend, of course. I find if I just take Breathe and I just have it like this and I just sniff one side, it feels so good, and sniff the other side, it really opens things up. And if you use it frequently, it can really begin to start draining, especially if you're in that state where things are just congested and not draining. If you use it over and over again, it's very helpful. Frankincense, just as a general anti-inflammatory, is always great, which is why I occasionally put that in my neti pot just to bring the inflammation down in the local area. Melaleuca, super great, antifungal, antiviral, and really wonderful antiviral as well, as is lemon. So there's a lot of different ways that you can use all of these oils. So topically, you can use them on the skin, but I really have to warn you, okay? Now listen to this, because I don't want you to get hurt. So a lot of the oils we're talking about are really aromatic, like peppermint, Digesen, all of them really. And we're talking about close to the eyes, right? So you don't want to burn your eyes. So if you're using some of these oils and you want to massage them in, then you might want to consider using a carrier oil with it. So you can take Digestin and massage it. And I'm just going to show you there are a few acupressure points that you can use are really great to combine with your oils. So there's a point right here between the webbing of your thumb and your finger. If you massage this clockwise, really helps release anything in the sinuses and the lungs like this. Put a little Digestin in your fingers and rub this, or a little peppermint oil, and just rub, like 1 or 2 minutes like this. It's usually tender. It's tender in a lot of us. It's very tender in mine right now. There's another place right here, and right below the ethmoid sinuses, right there, and right above the cheekbone. If you massage those clockwise for about 3 minutes, 2 to 3 minutes, really opens up the sinuses. This is another great place to use the oils, but this I would definitely just dab your finger in some olive oil, some fractionated coconut oil, some regular coconut oil, whatever you have, and put a little bit of peppermint on there, a little bit of Digestin, and then massage that, and it's really great for opening things up. There's another point right here, your third eye. If you massage that clockwise, again, really helps open up the sinuses. So those are some places you can use it. Now, if you happen to get too much oil in your eye, remember, just a cotton ball with any oil that you would eat, you can put on the cotton ball and just wipe, and just wipe, and just wipe. And usually by 3 times it takes care of it. The other great way besides topical is to inhale this. So it's the sinuses, right? It's a great way to get things in. So you can inhale, you can do a steam bath where you take a big bowl and put warm or hot water in there, put a few drops in, put a towel over your head and breathe. Really fantastic. Kind of hard for kids to do because sometimes they feel a little scared in there, and honestly I worry about the oils going into their eyes if their eyes aren't shut, and you don't want them to associate the treatment that's supposed to help them with pain and suffering, and it's very traumatic for everybody when that happens. So my suggestion is to do a steam cup, where you take a mug like this, and put a little hot water in there, and then put your oils in there, and you just have a little mini steam bath. So one of my favorite blends is to put a few drops of oregano, melaleuca, lemon, and eucalyptus in, and inhale that. Now sometimes I add lavender, because I find that when I'm not feeling well, I also don't feel great emotionally, and there's a little bit more soothing with the lavender. I just love the lavender smell, and I think that can be great for kids too. You're having them do some weird thing, and soothing them is really helpful. So putting a few drops of lavender in there can really help. Why clockwise? It's a Chinese medicine thing, and I honestly don't know. If somebody here is an acupuncturist, a Chinese medicine person, and can answer that either now or later, let us know. But there's something about, I think that the clockwise is releasing and clearing, and I'm sorry, I can't go into the whole Chinese medicine language because I don't know it well enough. So you want to inhale. Now you still have to be really careful of your eyes even with this. So make sure your eyes are closed. And if the water's really hot and it's steaming, you want to keep it at a far enough distance so it doesn't overwhelm you. It's pretty intense in the beginning, and then as it cools down, it gets a little bit less intense. You can sort of play with it, but it's automatically extremely clearing. You're getting all of the great antiviral, antifungal, antibacterial properties right where you want them into the sinuses. You can also take things internally to just generally help your immune system. So your On Guard is great to take if you feel like you're dealing with a viral or bacterial or fungal infection. Take that internally. You can also make up your own combinations with the little gels. Other things to consider, well, first of all, you want to make sure, consider taking, besides water to thin the mucus, is NAC. It's N-acetylcysteine. And that is a really great mucus thinner. It also supports the liver and its detox pathways, which is actually another thing to think about. You might want to think about doing some of the Zendocrine detox capsules to help your liver function better if you're dealing with an infection, because it will benefit that. Xylitol really helps with good biotic balance, so you could put some xylitol in your nasal wash, or just using it in taking internally can be helpful too. Colloidal silver in your neti pot is great, and that is really beneficial for wiping things out that you don't want in you. Glutamine internally really helps the gut lining, and that's going to support your gut microbiome. And vitamin C, of course, is great for your immune system, as is zinc and vitamin D and vitamin A and all that stuff. Really, you want to eat a healthy diet and take your supplements, take your LLV if you're taking those. That's really great and very supportive. You want to make sure that you are checking, especially for chronic, or frequent acute, that you've checked your environment for anything that might be causing this. So make sure you don't have mold or mycotoxins in your house. Make sure that you're not living in a sick building. You know what those are? Those are buildings that are either old and have decrepit, gross things like mold and funguses happening, or the air conditioning or heating systems haven't been cleaned, or it's a really new building that's so well insulated that it's not getting fresh air and moving the new carpets and the MDF and for the cupboards and the floor and all that, that as they get released, the air is not moving it out. There was something to those funky old houses with cracks in the windows to get some fresh air in there. So if you're in a situation where you think you might have a sick building, old or new, get it checked out and make sure. You can get air purifiers in your space, you can diffuse your oils to counteract it, and you can work on your diet and your health to support your system, even if you're in an environment that's not perfect for you, but do your best to clean it up. So one of the things I just want to say is that, remember, if you've got an acute infection, I know it's a drag and you're annoyed, but it really is your body doing its job. So thank it for doing its job. Support yourself on the emotional level. Use these therapies to help you move through it more quickly and efficiently, and it will support your body as a whole. If you have a chronic thing going on, then really look at those underlying issues. You know, is it your gut? Is it your diet? Is it an emotional thing or some combination of those, or is it an environmental issue? Usually it's a combination. So really begin to address that. And what I have to say is this stuff works well when you're consistent. And I have to say that's the trickiest part of it, right? When you've been dealing something with a long time, and I deal with this too at times, it's like, man, I'm doing my neti pot and I'm kind of tired of doing my neti pot. I've been doing it for months and months and months and months and months. And I just have to tell you a story of like almost 15, 20 years ago, I had a whole bunch of mercury fillings that I got taken out, and I was very fortunate to get them out. It was the last piece in a puzzle of this really bad chronic fatigue I had, and I got them out, and I didn't get my energy back until I got the mercury out of my body, and one of the places it was hanging out was in my sinuses, and I was doing the hot and cold and nasal lavage every day, twice a day, like every morning, every night, every morning, every night for like a year. And it was one day, I remember I was at Brighton Bush, I was working out there. I had a clinic I was running with another physician, and we were, I was doing a lot of the steam baths. I was in their little sauna that's really just like a steam room. And I was in there a lot, and I was doing my neti pot, and it's about the third day I was doing my neti pot, and these huge chunks of like this fluorescent orange stuff just came out of my nose. I was like, well, oh my God, what is that? And it was that toxic gunk. I couldn't believe there's that much of it living in there. I was like, no wonder I felt congested. And I have to say, like, after I got that out there, I felt amazing. And it was really just hanging in there. And I need to tell that story to myself to remind myself now to just keep going. And I say it to you too. And the same thing, even if you're dealing with an acute, like the breathe is great, but it works better if you're in an acute situation, if you're doing it every 30 to 120 minutes, like every half an hour to 2 hours. Set the timer on your phone and just remember to do it. That's when you're really going to notice the effects. Same thing, you know, if you're diffusing, it's like keep the diffuser going. Give yourself breaks if you're feeling overwhelmed by it, but keep it up and keep going. Oh, I didn't even tell you, DigestZen. Like one of the great ways to use DigestZen is you can massage there, but you can also put DigestZen in your belly button. And so again, just create a protocol for yourself and then create a schedule and then create alarms and reminders to stick on that schedule, and your health is going to soar. You're going to move through this acute thing a lot more quickly. You're going to be able to help your kids get well a lot more quickly. And if it's chronic, it will change. It really will. You're going to get better and you're going to feel good. So please let me know if you have any questions. Thank you so much for listening, and I just love being able to have connection with you guys. This is Dr. Jenny Tufenkian with a reminder to love. Take care. Thanks.